We're following on from our discussions about whether schools should provide food for hungry children. No one's disputing that hungry kids can't concentrate properly during classes. But a hungry child can also develop serious health problems if left unfed. Joining me now is GP Dr. Lance O'Sullivan. Welcome to breakfast.
Kia ora, Petra.
So when you see a hungry child in your clinic, somebody who's hungry regularly, what health problems do they present with?
Oh, look, I think a hungry child's going to have problems with diseases that are affected by malnutrition, infectious diseases, chest infections, skin infections, important infections like rheumatic fever, meningitis. So yeah, we have a lot of health problems related to children that are hungry, but I think a child that's hungry is a symptom of the poverty they live in. So a hungry child comes from a home that's cold, it's overcrowded, it has low income and high expenses and can't access important essential services like health. So, if you incorporate all of the issues that a hungry child brings to my clinic, they're significant. And actually, a prescription that I write won't solve the issue,
So you see hungry children, they're presenting with skin infections, with other infections, with malnutrition, so they're not growing properly, they're not accessing what they need for their bodies. You can try and fix them up, but what happens?
Well, I mean, it's a temporary measure. It's a plaster over, a gaping wound, if you like, that's not going to heal unless we address the deeper issues, which is the poverty they're living in. A hungry child, if we go back to that aspect of child poverty, is not going to learn because, as well as a child that's well fed, its brain, the development of that child's brain is important in terms of diets, very important. A child who's sick because they're malnourished is not going to be able to concentrate on what the teacher's telling them.
Okay, Lance, I've been to Cambodia, I've seen malnutrition in that form. Is that the kind of thing we're dealing with in New Zealand? How serious is it? Do you think Kiwis understand the situation?
Well, I think it's serious. I think if we've got a significant portion of our children that are going to school hungry on a daily basis in a country such as New Zealand, which is a developed country, I think that is a concern. I'm really supportive of the expert advisory group's recommendations around introducing food in schools for low decile schools around the country, and the proposal currently around getting 15,000 children fed per year is going to cost $3.3 million. Now that's 75 cents for every New Zealand citizen once a year to put in their hands in their pockets to pay. That's very little, and the outcome's going to be huge in terms of a generation of kids that are not going to go hungry, are going to learn, are going to be better employed and be a better and more productive workforce and have less impact on our health and welfare expenditure in the future.
Is food in schools the solution, or is it the first step?
I think it's a part of a suite of initiatives that need to be put in place to address the issue of child poverty. A hungry child is one aspect, but that child is also at 3 o'clock in the afternoon going home to a cold home. It's probably overcrowded, and that doesn't have the income, the minimal level of income to ensure they have a bright future.
Dr. Lance O'Sullivan, thanks for joining us this morning.